Hi there, it's Dr. Keough. Today I want to talk to you guys about blood testing and which blood tests are important for you to have. I'm often asked by our patients, what testing should I have done if I'm trying to be healthy and trying to have optimal health? So that's why I felt compelled to make this video, as well as we have lots of patients who come in and we ask them to bring in their lab tests, and so we can kind of have a baseline of what they've had done. And a lot of times we see people bring in tests that are there's not a lot to the tests. So I think it's important to talk about the most important tests that you should have done, lab tests that you should have done, so you really understand what's going on in your health, your doctor understands what's going on in your health, and you can really establish either a good baseline or really help to get your body back functioning optimally. So there's 8 tests that I recommend that everybody have done. And one thing I want to say first is, if you have a provider that you adore and you love and they run lab tests on you, ask them. If they're not doing all these, ask them to do them. Sometimes they will, and it's no big deal. You just have to ask for them. Other times, they may not run the test. I don't know why that is. If that's the case and you need somebody to run these tests, we are happy to run these tests. We do them right here in our office. So the first one, number 1, is a comprehensive metabolic panel. So that's going to provide an overall look at the chemical balance and the chemical makeup of your body, as well as how your metabolism is functioning. Very important. The second one is a lipid panel. So the lipid panel is going to give you an overall picture of your cardiac risk, and also help determine if you need to make dietary changes, like so many of us do. That's going to be total cholesterol, HDL, LDL, triglycerides, and if you have a history of heart disease for yourself or in your family, having an apolipoprotein B test as well. The third test is C-reactive protein, CRP. That is going to measure general inflammation in the body. So if the CRP is high, which it should never be high, but if it is high, you have to ask why. And that's going to be from a possible autoimmune disorder, a possible infection somewhere in the body, or the need for you to change your diet. So that's why CRP is really, really important to have run, and I don't see it being run enough in my opinion. The next one is the blood sugar profile. So the blood sugar profile is important because we need to know how we're utilizing our glucose on a day-to-day basis. And so making sure that your blood sugar profile isn't only fasting glucose, because that's important, but you have to have, you really should have a hemoglobin A1C, which is going to measure your blood sugars over the course of a 90-day period. So it really tells us overall how your blood sugars are looking over a long period of time, as well as a fasting insulin. Very important to have all of those tests if we really want a good idea of how your blood sugars are functioning. Test number 5 is thyroid. So thyroid panel is really, really important, and we see so many of our patients, mostly women, coming into our practice and stating that they are on Synthroid, or they were diagnosed with hypothyroidism, and all that was ever run was a TSH and maybe a T4. And so to me, that's just, it's impossible to really be able to diagnose and work with somebody's thyroid and their health if you don't have a full picture of how their thyroid is working. So in your thyroid panel, making sure that you run a TSH, but remember, we're practicing functional medicine in our office, so making sure that your TSH is within functional range. So 1 to 2 is optimal for that, for TSH. Also a free T3 and a free T4. And then a reverse T3. So if the reverse T3 is high, that can explain why thyroid symptoms are present when your TSH and your T3 is appearing to be normal on the blood tests. And then autoimmune thyroid, autoimmune thyroiditis, Hashimoto's, running those antibody tests, really, really important. And typically we don't see those being run enough either. So the next test is vitamin D. Vitamin D is another really, really important test. we consider the optimal range. We like people to be over 40, up to 60 is ideal from what I've seen. So, and it's interesting enough, low vitamin D can actually be correlated with people that have autoimmune diseases or immune challenges, infections, bone disorders, and mental diseases. So having your vitamin D levels checked is so simple, and it's really, really important to do. So having it between, I'm going to say 40 and 60 is ideal from what I'm seeing in my practice. And then complete blood count, test number 7. Having a complete blood count is really important because that's going to help us identify things like iron and ferritin and transferritin and B12 activity. So really looking for anemias, B12 folate, iron, those types of things. Really important to understand in somebody's body. And then the last test, test number 8, is testing your B12. So having an idea of what your B12 status is can really tell us a lot about nutritionally, is your stomach in a place where you can even absorb B12, because we absorb B12 through our stomach. Making nutritional changes, are those necessary? Are you dealing with a neuropathy? Or maybe you have detoxification and methylation issues, which could be related back to the genetic defect MTHFR. So those are the top 8 tests that I see in my practice that help us really understand what's going on with the patient on getting them a baseline, as well as helping them reach their optimum potential and helping them be as healthy as they can. So again, if you have a doctor, ask them to run these tests if they haven't run them. And if they're not going to run the test due to whatever reason, let us help you with that. We have a phlebotomist in our office that is here once a week, and she can run those lab tests right here in our practice. So hopefully this was helpful for you guys. If you have questions, don't hesitate to reach out to us, send us an email, Facebook message us, comment, and we hope to help you in your journey to getting healthier. Thank you so much. Have a great day.